You know, when you think about really high-stakes training, your mind probably jumps to a pilot in a flight simulator, right? Or maybe an astronaut prepping for a mission. It's all about precision, process, and literally zero room for error. But what if I told you there's another world where the training is just as intense, because lives are hanging in the balance every single day? Well, welcome to the world of cell therapy. We're going to go inside and see what it really takes to train the people on the front lines of this incredible medicine.
So, here's the game plan. First, we'll get into why this training is so unbelievably critical. Then, we'll break down the 3 pillars that build their expertise from the ground up. After that, we'll open up the trainer's toolkit to see the methods they use. And finally, we'll look at how they actually know if any of it is working.
All right, first up, why this training matters. It's so easy to get wowed by all the futuristic tech in a field like this, but the real secret, the absolute core of it, is the human element. The whole system is only as good as the highly skilled people running it.
And this quote just lays it all out there, doesn't it? This isn't some abstract idea. A mistake isn't just a simple do-over. It can be fatal. We're talking about something as small as a miscalculation in a cell count, a tiny shift in temperature, or a momentary break in a sterile field. That one sentence tells you everything you need to know about the pressure these teams are under. There are simply no second chances.
But here's the thing, it's not just about preventing disaster. Amazing training has this incredible ripple effect. When people are trained properly, their confidence just soars. They communicate better, they lead better, and that creates this highly motivated, fine-tuned team that's absolutely essential for pushing the science forward and keeping patients safe.
So how do you actually build that kind of expertise? Well, that brings us to our second section, the 3 pillars of learning. And let me tell you, this is not your average one-day workshop. It is a structured, lifelong journey that starts the second someone walks in the door.
The whole journey is really built on these 3 pillars. First, you've got orientation. That's all about getting your bearings, understanding the mission, the facility, the team. Then comes the big one, initial training. This is where they dive deep and master all the hands-on, critical procedures. And finally, there's continuous education, because in a field moving this fast, you can't ever stop learning.
And that initial training part? It's incredibly hands-on. It zeroes in on those key moments in the process where a mistake would be catastrophic. For those tasks, you don't just learn at once. Nope. It's practiced and repeated at set intervals until it's absolute muscle memory.
So that brings us to the how. How do you actually teach something this complex, this important? Well, it's not a one-size-fits-all approach. You need a whole toolkit of methods to make it stick.
And you can see they use a bit of everything. Of course, you've got the practical, hands-on sessions. But then you have things like case study analysis, where teams get together to talk through real-world challenges. They're doing online training, drilling their procedures over and over, and even rotating between departments so everyone understands the big picture. They even plan for the unplanned, with on-the-spot training to tackle new problems the moment they pop up.
And just to put a number on that commitment, to always be learning, key staff are required to log a minimum of 10 hours of continuing education in cell therapy every single year. That's how you ensure your team is always at the absolute cutting edge.
And who's doing all this teaching? Well, the trainer is maybe the most important piece of the puzzle. They have to be a proven expert, someone with deep skills and experience. But it doesn't even stop there. The effectiveness of the trainer is constantly being evaluated. This isn't just about knowing your stuff, it's about being a really, really good teacher. Okay, this brings us to our final and maybe most important section. After all this training, all this effort, how do you actually know it's working? How can you be sure your people are truly competent?
The answer is simple, and it's totally non-negotiable. The process is not over when the class ends. Training is only considered complete once it's been properly evaluated to see if it actually hit the mark.
For this, they use a really smart framework called Kirkpatrick's 4 levels. Think of it like a pyramid. At the bottom, level 1 is response. Did people find the training useful and engaging? Then level 2 is learning. Did they actually walk away with the knowledge they were supposed to? Next, level 3 gets real, behavior. Are they actually using what they learned back on the job? And at the very top, the ultimate test, level 4 is outcomes. Did the training actually improve patient safety and treatment results? It's a brilliant way to measure the true impact.
Because really, at the end of the day, that's what this all boils down to. The final exam isn't a multiple-choice test. The true measure of success is a therapy that works, and most importantly, a patient who gets better.
And to make sure nothing ever falls through the cracks, every single step gets documented. The plan, the session, who was there, the evaluation, all of it is recorded in the center's quality management system. The rule is simple. If it wasn't documented, it didn't happen. This creates a culture of total accountability and constant improvement.
So as we wrap this up, I just want to leave you with a thought. This incredible level of rigor, this deep dedication to training and evaluation, it's the standard in cell therapy because lives literally depend on it. And it kind of makes you wonder, doesn't it? And how many other critical fields should we be demanding this exact same standard?